Welcome back, everybody. We are diving deep into facts to remember today.
FTRs.
FTRs. I like that. You got an acronym for everything.
We do in medical coding, yes.
Which is great because it helps you remember everything. But these FTRs are going to be really helpful.
Yes.
When you're looking at medical coding, and especially if you're studying for your certification exams.
Absolutely.
And we're using some great insights from the Absolute Medical Coding Institute, and there's a link to their Medical Coding Guidelines Manual.
MCG.
MCG.
Yeah.
In the description below.
Yes.
But these FTRs are all about making sure that you are coding procedures accurately.
Yes, very important.
And we're going to focus today on some areas like cardiology and hemodialysis and even sedation procedures.
Sounds great.
So let's start with cardiology.
Okay.
Because I think it's so fascinating when you're looking at these codes, just how specific they can get.
Oh, for sure.
So let's say you're dealing with a cardiac catheterization.
Okay.
How do you even begin to choose the right code?
Well, you have to investigate a little bit. It's like a detective game. You have to figure out, first, was this for a congenital condition or some other reason?
Okay.
Then you have to figure out, is it right or left heart? Did they do angiography? Did they do a leadless pacemaker? So there's lots of different pathways you can go down.
Oh, wow. That's a lot to keep track of.
It is.
So let's say a patient has a leadless pacemaker implanted.
Okay.
Does that change how we code for a right heart cath, which is often part of that process?
It's a great question, and it brings up a really good point. It's all about the why of the procedure.
Okay.
So with leadless pacemakers, unlike a traditional pacemaker that has leads, you don't code the right heart cath if it's only done as part of the leadless pacemaker insertion.
Okay.
You only code it if a full diagnostic study was done.
Got it.
For a completely different reason.
So it's all about the why.
Yes, it is.
You can't just blindly apply codes.
Exactly. The documentation is your best friend.
Right.
It needs to clearly say why each step was taken so you can pick the most accurate code.
That makes perfect sense.
And by doing that, that helps the providers get paid appropriately, and also it protects the patient from being billed incorrectly.
Yes. It's not just about exams.
Yeah.
It's about the integrity of the whole system.
Exactly.
So let's move on and talk about a procedure that often goes hand in hand with cardiac catheterization, and that's moderate conscious sedation.
Okay.
Now, sedation coding.
Yes.
This is interesting to me because age actually plays a big role here.
It does.
The codes that you're using actually vary.
Yes.
Depending on how old the patient is.
Right. Which makes sense if you think about it. A younger patient might need a different level of care and monitoring than an adult patient.
Exactly. So let's imagine a scenario where we have a patient who is undergoing a cardiology procedure and needs moderate conscious sedation.
Okay.
What are some of the key things that coders should be looking for in the documentation?
Sure. Well, first you want to find out, is the same physician performing the procedure also doing the sedation, or is it someone different?
Oh.
And then the age of the patient, especially if they are under 4 years old.
Right.
The documentation should very specifically outline the complexity of the care that was given.
That's a good reminder that coding isn't just about memorizing codes. It's about understanding the nuances of patient care and how they translate into accurate billing.
It is.
And that brings us to hemodialysis.
Okay.
Now, you might think, okay, dialysis is pretty straightforward, but it can get pretty complex depending on the patient's situation.
For sure.
So what makes hemodialysis coding tricky?
Well, you'd have to think about things like, is it end-stage renal disease? Is it not?
Right.
Where's the location of the service? Inpatient, outpatient, at home? And of course, age of the patient.
All right, so it's like each patient is a puzzle.
It is.
And the coder has to put all the pieces together to get the full picture.
Yes, you got it.
To get the right code.
You got it.
So when you're looking at hemodialysis coding, you have to consider the time frame of the care.
Okay.
There are monthly codes that capture the physician's work.
Right.
That goes beyond just administering the dialysis itself.
Right. They're managing the patient's condition.
Right. So it's not just about the procedure.
Right.
It's about that comprehensive care that surrounds it.
Correct.
But what about those individual assessments that happen throughout the month?
Yeah.
How are those coded?
So that's where the per-day codes come into play. They capture those specific instances where the physician is evaluating and managing the patient's condition.
So it's like you have a wide-angle lens to capture the ongoing care.
Right.
And a zoom lens to focus in on those specific check-ins.
You got it.
Now, you might be wondering, why are we spending so much time on these seemingly small details?
Yeah.
Well, here's why it matters.
Okay.
getting these codes right,
Yes,
it has a ripple effect throughout the healthcare system.
it does.
It's not just about getting the right answer on an exam.
Right.
Accurate coding makes sure that the providers are being reimbursed fairly
Yes.
for the complex work that they do,
Especially for those chronic conditions,
especially with chronic conditions.
like end-stage renal disease.
Exactly.
Yeah.
So it allows them to continue providing that quality care to patients.
Absolutely.
And then on the flip side, it protects the patient
Yes.
from being overcharged,
Yeah.
from being billed incorrectly.
For sure.
It's about fairness
Yes.
and transparency
Yeah.
for everybody involved.
Absolutely.
So let's circle back to cardiology
Okay.
and talk about how we code those comprehensive or global cardiology services.
Okay.
Now, global cardiology services, those sound like they encompass a lot.
They do.
What do we need to know about them from a coding perspective?
Sure. So there's a key distinction between the global cardiology services and the component cardiology services.
Okay.
And so it all depends on what services were provided. If it's a global service, you're going to use 93015.
Okay, so if it's all-inclusive,
Yes.
we have one code to rule them all.
Right.
But what happens if you have separate professional and technical components? So like if different providers are handling different aspects.
Right. Then you would bill the professional component and the technical component separately.
So it's like ordering a combo meal
Yes.
versus choosing each item a la carte.
Exactly.
And I'm guessing clear documentation is key here too.
Oh, absolutely. The medical record needs to spell out what was done, who did it, and why, so the coder can pick the right code or codes to reflect all those services.
It's all about capturing the details
Oh, yes.
and translating them into that language of codes.
You got it.
Now, while we're on the subject of cardiology, there's another procedure that I wanted to talk about, and that's percutaneous coronary intervention, or PCI.
Okay, PCO.
Now, PCI, it's a whole world.
It
You're
is.
dealing with procedures like stent placement,
Yeah.
angioplasty, atherectomy.
Yes. It can get quite complicated.
So how do you even approach that from a coding perspective?
Well, just like with cardiac cath, you have to break it down step by step.
Yeah.
What major coronary vessel was treated, what type of procedure was done, single site, bifurcation,
Sure.
were there any additional vessels or branches treated?
Oh my goodness.
Yeah, there are a lot of decisions.
So many decisions. It's like those choose your own adventure books,
Right.
but with medical codes.
Exactly.
And I bet this is where those FTRs come in handy.
Oh, they do. They help you break it down into those manageable steps so you can get the coding right.
And which, as we've discussed,
Yes,
it has far-reaching implications for the providers and the patients.
it does.
It's not just about getting a good grade on an exam.
right.
It's about the real-world impact
Absolutely.
of that accurate coding.
Sure.
Now, speaking of real-world impact,
Okay.
let's shift our focus back to hemodialysis.
Okay.
Now, we talked about some of the complexities earlier, but I want to delve in a little bit deeper.
All right.
So we talked about location.
Uh-huh.
We talked about age.
Yep.
We talked about the difference between those monthly and per-day codes.
Right.
What else should listeners know?
Well, one thing that tends to trip people up is the completeness of the physician assessment. Did they do a comprehensive assessment or was it problem focused?
Well-
And so the level of detail captured in the documentation will determine what codes you can choose.
So even within those per-day codes, there are different levels of complexity
There are.
that need to be reflected.
Yes.
It's all about matching the code
Yeah.
to that specific service that was provided.
Exactly.
And this is where those FTRs can
Yes.
be incredibly helpful.
Yes, they are.
Because they distill those complex coding guidelines
Yes.
into those bite-sized pieces of information.
Uh-huh.
So it makes it a little bit easier
Yes.
to remember all those key factors
Yeah, exactly.
that influence that code selection.
Uh-huh.
So they're like mental shortcuts
They are.
to help you navigate that maze of coding rules and regulations.
That's a great way to put it.
So speaking of mental shortcuts,
Yes.
I wanted to talk about those comprehensive
Okay.
or global codes that we mentioned earlier.
Yes.
They're like all-in-one packages.
Yes, they are.
That can really help you simplify that coding process.
For sure.
So when would we use those global codes? And how do they differ from those component-specific codes?
Okay, so you would use a global code when one service covers both the professional and the technical component.
Okay.
So, for example, if a cardiologist does the EKG interpretation and does the tracing, then you would use a global code.
Got it.
But if those were done by two different providers or at two different times,
Okay.
then you would use the professional and the technical codes separately.
So it's about bundling versus unbundling.
Yes.
The services depending on who did what
Yes.
and when.
Uh-huh.
And this can streamline the coding process.
Yeah.
When it comes to cardiology,
Yes,
global codes can really be a lifesaver
absolutely.
because they simplify the coding for those common services,
Exactly.
like EKGs, stress tests, and even certain types of echocardiograms.
Uh-huh.
That's great to know.
Yes.
It's all about finding those efficiencies
It is.
to make the coding more accurate and less time-consuming.
For sure.
Now, speaking of efficiency, I want to shift gears and talk about moderate conscious sedation.
Okay.
We touched on this earlier.
Yep.
But I want to delve a little deeper into the coding nuances.
Oh,
So, we know age is a big factor in sedation coding.
it is.
What other factors do coders need to be aware of?
Okay, so you want to ask yourself, who is performing the sedation? Is it the same physician doing the procedure, or is it a different provider?
Okay.
And so depending on who is doing it
Right.
will determine what codes you will use.
So it's like that 2-for-1 special versus the a la carte situation.
Exactly.
Now, regardless of who is doing what,
Uh-huh.
meticulous documentation is always crucial.
Yes, it is.
And this is especially true
Yes.
when you're dealing with those younger patients.
Uh-huh.
The documentation really needs to clearly support that additional complexity
Yes.
that's involved in their care.
Absolutely.
All right, so we've covered a lot of ground today,
We have.
from cardiac cath to hemodialysis to moderate conscious sedation.
Yes.
And it's clear that accurate medical coding
Uh-huh.
involves a lot more
It does.
than just memorizing those codes.
For sure.
It's about understanding those nuances of patient care,
Yes.
interpreting that complex medical documentation,
Yes.
and really applying your knowledge
Uh-huh.
to choose the most accurate codes.
Absolutely.
And as we've discussed,
Yeah.
that accuracy has ripple effects
It does.
throughout the entire healthcare system,
For sure.
impacting providers,
Uh-huh.
patients,
Yeah.
and payers alike.
Absolutely.
So for our listeners who are really eager to learn more about this fascinating world of medical coding,
Yes.
be sure to check out that Medical Coding Guidelines Manual.
The MCG.
The MCG.
From the Absolute Medical Coding Institute.
From the Absolute Medical Coding Institute.
Yeah.
And you'll find that link
Yes.
in the description below.
You got it.
It's an invaluable resource
It is.
to help you navigate those complexities of coding
Mm-hmm.
and prepare for those all-important
Yeah.
certification exams.
Yes.
But even beyond the exams,
Yeah.
it's about understanding the why behind the what.
Yes.
The reasons why accurate coding matters
Uh-huh.
so much
Yeah.
in the real world.
Absolutely.
It's not just about memorizing codes.
Right.
It's about understanding that bigger picture and the role that coding plays
Yes.
in ensuring a fair
Yes.
and an efficient healthcare system.
Absolutely.
And on that note, we're going to take a quick break. When we come back, we'll continue our deep dive into these fascinating FTRs, exploring even more coding scenarios and unraveling those complexities of medical billing. Stay tuned.
We'll be right back. We were talking about global codes in cardiology and how they really simplify things.
Yeah, they really are like having a shortcut key
They are.
for some of those more straightforward services,
Yes.
especially when both the professional and the technical components are all bundled together.
Absolutely. Working smarter, not harder.
Right.
But let's shift gears a little bit and go back to hemodialysis.
Okay.
Remember those monthly codes that captured that ongoing management?
Yes, all the behind-the-scenes work that the physicians are doing to manage those complex patients.
Exactly. So you might be thinking, well, what if the physician provides additional services beyond that monthly management?
Okay, so let's say, for example, a patient with end-stage renal disease needs an EKG.
Okay.
Would that be bundled into those monthly management codes?
That's a good question, and it brings up a good point. Certain services like EKGs are separately reportable,
Okay.
even when they are provided to a patient receiving those comprehensive monthly end-stage renal disease services.
So it's like adding toppings to your pizza.
Yes.
You've got your base covered,
Uh-huh.
but those extra ingredients get their own line item.
Exactly. Now, let's say that same patient is receiving chronic hemodialysis.
Okay.
But now they need an evaluation and management service, an EM service.
Would that be bundled or would that be separate?
Well, it depends. If the EM service is related to the patient's underlying renal disease and it's provided during the monthly dialysis period, then it's included in those comprehensive codes.
Oh, so it's like having a built-in checkup as part of that ongoing management.
Exactly. But here's the catch. If that EM service is not related to the renal disease or happens outside of that monthly dialysis period, then it's reported separately.
So it's all about the context.
It is.
Is it part of that routine management or is this something distinct and separate.
Exactly.
Okay, now I want to talk about a procedure that often goes hand in hand with hemodialysis,
Okay.
percutaneous coronary intervention,
Yeah.
or PCI.
Okay. PCI.
We talked about it briefly before,
Yes.
but I want to learn a little bit more about the coding specifics.
Okay.
It's such an intricate procedure with so many different variations.
It is, and coding PCI is kind of like navigating a maze.
Okay.
You start with what major coronary vessel was treated,
Right.
and then from there you need to figure out what type of procedure was done. Was it single site or bifurcation? And were there any additional vessels or branches treated?
So it's like following a decision tree,
It is.
with each answer leading you to a more specific code.
Exactly. And that's where those FTRs come in handy.
Right.
To help you break down those complex decisions into manageable steps.
Because as we've said before, that accuracy
Yes.
isn't just about getting a good grade on an exam.
Right.
It's about making sure that those providers are being reimbursed fairly
Absolutely.
for all that intricate work that they're doing.
For sure.
It's about recognizing the value
Uh-huh.
of those procedures and reflecting that value in the coding.
Yes.
Now let's talk about evaluation and management services, or EM services.
Okay. The bread and butter of medical coding.
Right. They capture all of those essential interactions
Yeah.
between patients and physicians, from those routine checkups to those really complex consultations.
Absolutely. And they can be tricky.
Yeah, especially when you're dealing with some of those higher level codes
Yeah.
that involve a lot of decision-making and complexity.
Yes. One of the biggest challenges is making sure the documentation supports the level of service that's being billed.
So it's not enough to just list the services performed. You also need to capture the complexity
Yes.
of that medical decision-making that was involved.
Exactly.
But how do you translate all of that complexity into a code?
Well, that's where those FTRs from the Absolute Medical Coding Institute can really help.
Right.
They give you that guidance on what needs to be documented to support each EM level, so you pick the right code.
They're like roadmaps
They are...
to help coders navigate some of those really tricky EM coding scenarios.
Exactly. Now, let's go back to cardiology for a second.
Okay.
And talk about consultations.
All right, so consultations are when a patient is referred to a specialist for a second opinion or specialized care.
Right. And they can be tricky because you have to make sure you're differentiating them from other EM services like an office visit or a hospital admission.
So what are some of the key things that set a consultation apart from those other types of visits?
Sure. So first, there has to be a formal request for the consult from another physician or other qualified healthcare professional.
Yeah.
Second, that consulting physician has to give their opinion or advice back to the referring provider.
So it's like a two-way street.
It is.
You've got the initial request for the expertise,
Right.
and then the consultant shares their findings and their recommendations.
Exactly. And then third, those recommendations have to be documented in the medical record along with any services they performed.
So documentation is key, as always.
It is.
It's about capturing the essence of that consultation
Yes.
and translating it into those all-important codes.
You got it.
Now, what happens if a patient is admitted to the hospital for a cardiology consultation?
Okay.
How do we code that differently?
That's where you have to understand those FTRs because the hospital consultation codes take into account the unique circumstances of inpatient care,
Okay.
like reviewing the records and coordinating care with the other specialists and giving those follow-up recommendations during the hospitalization.
So it's not just about the initial consultation.
It's not.
It's about that ongoing involvement
Correct.
throughout the patient's hospital stay.
Yes, and so those codes are structured a little differently to reflect that.
So it's all about choosing the code that accurately reflects the complexity and the intensity of the physician's work,
Yes,
whether it's in the outpatient setting or in the hospital environment.
exactly. And that's why those FTRs are so valuable.
Right,
They
yeah.
give you that clarity and guidance
Yeah.
that you need to be able to navigate these complex coding scenarios.
They're like the essential tools
They are.
in a coder's toolkit to help them break down those complex coding rules and apply them accurately.
Exactly. Now, speaking of tools, let's talk about something that's really helpful when you're trying to decipher those tricky cardiology codes.
Okay.
Documentation guidelines.
Ah, yes, documentation, the cornerstone of accurate coding.
It is.
We've talked about it a lot
Yeah.
throughout this entire deep dive,
We have.
but it's worth emphasizing again and again,
Yes, it is.
especially when it comes to cardiology coding.
Yes.
Because that documentation needs to be crystal clear. It needs to clearly identify the procedures that were performed. The anatomical locations. Any complications,
Yeah.
any special circumstances that were encountered.
Exactly. It's like painting a picture with words
Yes.
so the coder can see what happened.
Right. And all those details matter.
They do.
Was it right heart or left heart? How many vessels were treated? Was a stent placed? And what kind of stent?
All of those details are important.
Wow. So many details to capture.
They are.
It's no wonder that accurate cardiology coding requires such meticulous documentation.
It does. And don't forget about those modifiers.
Oh, yes, those 2-digit codes.
Yes.
That can provide that additional information about the procedure. Those can make a big difference
They can.
in how a claim is processed.
For sure.
So it's really crucial to make sure that they're being used correctly.
Absolutely. It's like adding the finishing touches to your masterpiece.
Yes.
Making sure that every nuance is captured and every detail is in place.
So when you have that clear, concise documentation that supports the codes that you've chosen, you're well on your way to ensuring accurate billing and fair reimbursement.
Absolutely.
For those really vital cardiology services.
Yes.
Now let's shift gears just for a moment and go back to hemodialysis.
Okay.
Talk about billing for those essential services.
All right. Hemodialysis billing. Attention to detail is key.
Yes.
Remember those monthly codes that capture the physician's ongoing management of patients with end-stage renal disease?
Yes, those comprehensive codes that encompass everything.
Everything.
From evaluating the patient's condition to coordinating care with other specialists.
Exactly. Now, when it comes to billing for these services, there's a few things to keep in mind.
Okay.
First, make sure you're using the correct code for the patient's age and the setting of care.
So just like with the coding, those details really matter.
They do. And second, be aware of those billing guidelines for those separately reportable services.
Right, like the EM services and the EKGs.
Exactly, those things that are not included in those monthly codes.
So it's like having two separate tracks.
It is.
One for those bundled monthly services and one for those standalone procedures.
Exactly. And third, you have to document everything.
Right.
The billing process relies so heavily on that information.
Right.
So make sure the documentation is complete and accurate.
So accurate coding is just the first step.
Yes.
Accurate billing takes it to that next level.
Exactly. And when you have both, you're ensuring that the providers are being fairly compensated for the essential services that they're providing to these patients.
It's about closing the loop.
Yes.
From patient care to coding to billing.
Yes.
With accuracy and integrity at every step.
You got it.
Now let's circle back to cardiology just for a moment.
Okay.
And talk about compliance.
Compliance.
Because compliance is so essential
Yes.
for maintaining the integrity of medical billing.
Absolutely. It's about adhering to all the laws and regulations and the ethical guidelines that govern medical billing and coding.
Now, when it comes to cardiology, are there specific areas that we should really focus on?
Well, documentation of evaluation and management services.
Right.
Remember, the documentation has to support the level of service that's billed.
Right. You can't just say the patient came in for a checkup.
Exactly.
You have to capture that complexity
You do.
of the medical decision-making.
And if you don't, it can trigger an audit.
So it's not just about getting the codes right.
No.
It's about making sure that the documentation tells the whole story.
Exactly. And then also modifiers.
Right. Those 2-digit codes.
They have to be used appropriately and they have to be supported by the documentation.
So it's not just about knowing the codes.
Right.
It's about knowing how and when to use them
Absolutely.
correctly.
Yes, that's why it's so important to stay up to date
Right.
on those coding guidelines and compliance regulations.
Because the rules are constantly changing.
They are.
So you have to have those reliable resources.
Yes, you do.
Like those FTRs.
From the Absolute Medical Coding Institute.
They're like those trusted guides to help you navigate the ever-changing landscape of medical coding and billing.
Absolutely.
Now let's step away from cardiology
Okay.
and go back to moderate conscious sedation.
Okay.
Now we talked about how age plays a big role in coding for those services.
Yes.
But what about the billing implications?
Oh, good question. So when it comes to billing for moderate conscious sedation, there's a few key factors.
All right.
First, who provided the service? Was it the same physician doing the procedure, or was it a separate anesthesia provider?
It's like that 2-for-1 special
Exactly.
versus ordering a la carte.
The billing codes will vary depending on who did it.
Right.
And second, you have to document the time
Right.
that was spent providing the sedation. This is very important.
Because time is literally money in this case.
It is. And third, you have to know the payer guidelines.
Oh, right.
Because some payers have very specific requirements.
So it's always a good idea to check with the payer
It is.
beforehand just to make sure you're on the same page. To avoid some of those billing headaches.
Yes.
And ensure timely reimbursement.
Exactly.
So we've covered a lot of ground today,
We have.
from cardiology
Yes.
to hemodialysis
Yeah.
to moderate conscious sedation.
hmm
And it's clear that accurate coding and billing requires a deep understanding of the rules,
It does.
meticulous attention to detail, and access to those really reliable resources.
It
It's
does.
a very complex field that's constantly evolving,
Yes.
but with the right tools and knowledge, you can navigate it with confidence.
Absolutely.
And speaking of tools,
Okay.
I want to remind our listeners about that really valuable Medical Coding Guidelines Manual from the Absolute Medical Coding Institute,
The MCG.
the MCG, and you'll find a link in the description below.
Yes, you will.
It's a really great resource
It is.
to help you stay up to date on all the latest coding guidelines and billing regulations.
Absolutely.
So as we wrap up this portion of our deep dive, I want to leave our listeners with a thought-provoking question to ponder.
Oh, okay. I like it.
As healthcare technology continues to advance at such an unprecedented pace, how do you think coding and billing practices are going to have to adapt?
That's a really good question. I think about that all the time with telehealth and remote patient monitoring and artificial intelligence. All of these things are really changing how we deliver care.
It's like we're building the plane
Yes.
while we're flying it.
Exactly.
But that's also the exciting part.
It is.
We have the opportunity to really shape the future of healthcare
We do.
through accurate and innovative
Yeah.
coding and billing practices.
Yeah, absolutely.
So to our amazing listeners,
Yes.
keep learning
Keep questioning.
and keep those coding manuals handy.
You got it.
We'll be right back after a quick break. Stay tuned. So before the break, you were talking about how coding and billing might have to adapt as technology changes.
Oh, it's a big question.
And it really feels like we're on the cusp of some major changes
I think so too.
in healthcare.
Think about all the things that are going on with telehealth, remote patient monitoring, artificial intelligence.
Yeah.
It's really changing how we deliver care, which means that our coding and billing systems are going to have to change too.
It's like we're building the plane as we're flying it.
That's a great way to put it.
But it's exciting
It is exciting.
because we have this opportunity to shape the future of healthcare
Absolutely.
through accurate and innovative coding and billing.
Yes, and you brought up remote patient monitoring.
Yeah.
That's becoming so common, especially for chronic conditions
Right.
like heart failure, diabetes.
Yep.
But how do we capture what the physician's doing when they're reviewing that data and making those treatment decisions?
Right, because those traditional EM codes, they might not cut it
They might not.
for those virtual interactions.
And then you've got artificial intelligence.
Oh, yeah.
Can you imagine having AI algorithms helping us analyze medical records and suggest codes?
Right. But then you have to think about, well, how do we make sure that they're accurate?
Yes.
How do we make sure that they're unbiased? Who is ultimately responsible for those decisions?
That's a great question, and I think it brings up those ethical considerations when we're
Yeah.
talking about AI in healthcare.
Yeah.
It's not just about the technology, it's
Right.
how we use it responsibly, ethically.
And that brings us back to the human element of coding.
It does.
Because even with all of these technological advances,
Right.
we still need skilled coders
We do.
who can interpret those nuances of patient care,
Absolutely.
who understand those ever-changing guidelines,
Yes.
and who can make sure that the billing practices are accurate and ethical.
Couldn't agree more. The human touch is so important, especially as technology is evolving in healthcare. We need coders who can bridge that gap between the clinical world and the financial world.
And making sure that patients are getting the care that they need
Yes.
and that providers are being fairly compensated.
Absolutely. Medical coding, it's more than just a job.
Yes.
It's a vital profession
Absolutely.
that impacts the entire healthcare ecosystem.
And to all of those aspiring coders out there, remember,
Your work matters.
Yes.
You're not just assigning codes, you're contributing to the efficient and ethical delivery of healthcare.
that's a really powerful message.
It is.
And for anyone who wants to dive deeper into this world, be sure to check out the Absolute Medical Coding Institute's Medical Coding Guidelines Manual. You can find the link in the description below.
It's a great resource.
Yes. And on that note, we're going to wrap up this deep dive. It's been an incredible journey exploring all the complexities of cardiology, hemodialysis, and moderate conscious sedation coding.
It has, and we just scratched the surface.
Yes, there's so much more to discover in this world of medical coding.
Absolutely.
So to our amazing listeners,
Keep learning.
keep questioning.
And keep those coding manuals handy.
We'll see you next time.